the main goal or the aim of the partnership is to train as many psychiatric nurses in the Upper West region as possible on how to deliver alcohol brief interventions or ABIs, and motivational interviewing, and how to elicit change in people who have drinking problems. And these psychiatric nurses, who are called champions, are supposed to train the frontline medical staff in their various hospitals, being it district, sub-district hospitals, train frontline healthcare staff in medical, surgical, maternity and accident and emergency departments, to be able to carry out alcohol brief interventions as means of being able to cut down the number of people who end up in late stages of drinking problems. The Upper West region records show that it's the region with the second highest incidence of drinking in Ghana. After Upper East, Upper West is the highest with a number of alcohol cases, and it's evidenced in the number of road accidents that occur in the region, because motorbikes are the most widely used means of transportation, and there are lots of accidents being caused by motorbikes. Secondly, people in Upper West region have a local drink they call pito, and it's brewed locally, and the folklore says that they believe it's food or water, so it's widely abused because of the misconception that it hasn't got alcohol. Actually, it's brewed from malt, but it's fermented, so it has a high alcohol percentage. But the native folks who are not educated don't see it as alcohol. So a farmer goes to the farm, instead of drinking water or eating food, he drinks pito, and it's handed down from generation to generation. Upper West region is about 10 to 12 hours drive from the capital, that's Accra, and it has 11 districts, and out of the 11 districts, not all have district hospitals, and not all have mental health units. It can take you about 3.5 hours to travel within one district within the Upper West region. For example, for Wa to Timur district, because of bad roads, you could take about 3.5 to 4 hours to get there. And assuming you have a client size of 20 in that district, and you're supposed to use in and out of about 8 or 9 hours to get there, you can't meet the number of patients you're supposed to. In the Upper West region, the mental health nurse does far more than he's supposed to do. For example, because we are understaffed, so we are attending to epileptic cases, psychotic cases, depression, and all sort of cases. And you agree with me that alcohol has a link in almost all these conditions. Alcohol can induce a seizure. Alcohol can lead to psychosis. Alcohol can lead to depression. So, and with this partnership, as we are cutting down the amount of alcohol people drink, in a way we are improving their mental health status, and it brings down the burden on the few mental health workers in the region. Working with the partners in the UK, it's a very good model, because we are understaffed in the Upper West region of Ghana, and psychiatry hasn't gotten the attention it so much deserves. So it's a bit of a neglected area. So this model, where they train the few psychiatric nurses to empower them to train other healthcare staff, it's a good model because it cuts down costs. Otherwise, they should have been training lots of people, and that comes with a huge financial implications, as compared to training a few who are qualified in the field of mental health already, to be able to cascade training to other healthcare staff, and just with the goal of cutting down the number of alcohol cases. So it's a very good model. As part of the partnership, THET is supposed to support 2 champions as psychiatric nurses in Ghana to visit Scotland on an educational tour, and then I feel it's a step in the right direction, because there's a popular saying in Ghana, that travel and see. Yeah, you don't know whatever you have until you've seen what someone else has. And I understand Scottish have a strong culture for drinking, so we could be able to learn lots of things from them, and we will come back and apply it wherever we find ourselves, and we'll all be in the betterment of making people's lives better. And I'm sure that's the main goal of THET, trying to improve people's lives, making the world a better place to live in. Yeah.